Bruh. Hagrid. Today is one of those days where I feel like a PS1 Hagrid. We've all had that day, that kind of day before. Let's jump right on into this video. So in today's video, we're going to be looking at two different types of antidepressants that are commonly prescribed today. They are known as SSRIs and SNRIs. And we're going to be looking at four key features and / common questions that patients have, or that they ask in the psych setting, they ask me, or just in general, common knowledge information to know about these two different types of antidepressants and which one might be better for you if you're discussing it with your doctor or whatnot. So check this out. If this is any help, leave a comment, like, subscribe, you know the deal. Okay, so number one, from a chemical perspective, an SSRI is going to be using and affecting your serotonin. Prozac, Ritalin, Zoloft, etc., etc. Then you have your SNRIs, your serotonin norepinephrine inhibitors. And these will be things such as Lexapro, Cymbalta, Wellbutrin to an extent, these types of medications. Now, the main thing is, once again, a lot of times when somebody's first starting a medication, they have no history of trying meds, they'll typically start you on an SSRI, typically. However, if you've tried that in the past, as stated in other videos, typically they will go to an SSRI plus an SNRI, or maybe take you off the SSRI in general, because an SNRI affects your serotonin and your norepinephrine together. So an SNRI is affecting both. An SSRI is just affecting the serotonin. Now, so from a chemical perspective, they're different. Now, the second thing to know, from an energy perspective, a lot of times with SSRIs, Prozac, Zoloft, you name it, those ones can affect your energy levels, and they might be a little bit lower when you're taking it, and that can be reported. Now with an SNRI, a lot of times, well, not a lot of times, but more commonly, patients report higher energy levels, focus, and even attention. So depending on, let's say you're somebody who has a history of high blood pressure, high heart rate and whatnot, you might want to stay away from an SNRI because sometimes heart rate can be a little bit higher because of it. And also in general, which we'll get to in a minute, we'll discuss the sleeping. But if you're an active person, a lot of times it can affect just your motivation to want to exercise. This is an SSRI. Now the third thing I want to jump into is weight. Now with an SSRI, weight gain is more common. Now with dose management and whatnot, that sometimes can be avoided, but with an SNRI, weight gain can happen, but it's not nearly reported because, once again, a lot more, you have higher energy levels, you will have better motivation with it, and this just has to do with how it's affecting, once again, your brain chemicals, which would be your serotonin and your norepinephrine. Now, that isn't to say that with an SSRI that it's going to affect your energy. I'm just reporting what I commonly see in the psychiatric setting in regards to these. But don't let that turn you off, because there are also people who take stuff in particular, such as so Prozac is an SSRI that a lot of times when it comes to energy, that's one of the SSRIs that patients do not report it affecting a lot of times. In the beginning, when you first start taking any antidepressant, there's going to be that placebo effect of where you're the anticipation. And with SSRIs and SNRIs, the time for them to start affecting you, remember, it's not instant. It can take upwards of 2 to 3 weeks to hit peak, 3 to 4 to hit peak effect, but even a week to 2 to start noticing if it's affecting you in any way. So once again, to sum this up, on number 3, weight gain, more common with SSRIs. Now the final one, and before you do this, please like and subscribe to the channel. I greatly appreciate it, and leave a comment. The final one is going to be sleep. Now, they both, and this is with any antidepressant, they all can kind of affect your sleep in one way or another. Now, More common, if you are somebody who's being prescribed an SNRI, this would be something to discuss with your provider. Because if they're saying, because sometimes they'll be like, oh, you want to take it mid-afternoon, something like such as Wellbutrin, Cymbalta, you got to be cautious on when you're taking it because it really can keep you up at night, especially with the SNRIs. But sometimes I have seen them prescribed in lower doses if they need like a second dose of it. A slower dose of like Cymbalta, like 10 milligrams, no later than like 12, well actually than like 2 o'clock or 1400. But when it comes to sleep, SNRIs are typically medications that you want to take earlier in the morning. And finally, when we're talking about sleep, with SSRIs such as Prozac or even Zoloft, the main thing I will say with this is that everyone's different and sleep patterns can be affected differently. I know people where they have to take it in the morning because it helps a little bit more with their energy and focus, even though I've been talking about how typically SSRIs don't do that. Prozac is sometimes can be the exception to it. So if they take it later in the day, it's going to be harder for them to sleep. But at the same time, I've seen people who have to take their Prozac later at night to help them sleep, because sometimes with SSRIs, one thing I'll say about sleep, if you take them later in the day, sometimes patients report, if you don't like things like trazodone, it actually really helping your sleep, which puts you in a better mood for the next day. Now, I know that was kind of a rant on SSRIs and SNRIs, but I just wanted to get that video out there. That is your another random video. That is your daily dose of mental health. We're going to be covering all things mental health. Check out my 365 days of running shorts playlist. I'll post that at the end. Check out my previous video in regards to anxiety meds. And lastly, we're going to keep on putting out random videos. I still have a lot more methamphetamine videos coming out, heroin videos, in regards to, once again, education and whatnot, what I've seen in the psych setting. And also just some experiences in the past with things I've personally experienced or what, from my perspective, what I've seen. Now, that is it. Like and subscribe. Have a good week.